Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us today. You know, if you're waiting for a life-saving treatment, it can be painfully slow, especially if you or someone that you love has a rare condition. So what happens when federal drug regulators won't review data for a treatment that you were waiting for? Our guest today, Dr. Eileen McCormick, Pediatric Neuromuscular Director at the Beaumont Neuroscience Center in Royal Oak, Michigan. And with her is Joanna Johnson. She lives in Downingtown, Pennsylvania with her husband Paul and two sons, Elliot and Henry. We're here to talk about a rare form of muscular dystrophy. Welcome to the program, ladies.
Thank you for having us, Neal.
Thank you. Dr. McCormick, have you always been involved with muscular dystrophy? Is this something that you've been interested in as long as you've been a medical practitioner?
It's true. It's true. I was a nurse before, and I became very involved early on with this population. It's very fulfilling for me, both personally and as a professional.
Now, when it comes to muscular dystrophy, we hear about the disease, but this is a rare form. How many forms of muscular dystrophy are there, if you can name them?
Yeah, there's so many. The laundry list will not permit here. But muscular dystrophy in general affects our muscles in the arms, legs, also potentially the heart and lungs. And then we subcategorize it based on genetic testing, based on the presentation of the patient. Are they presenting early in life, adolescence, later in life, for example? Duchenne is a population within muscular dystrophy. So Duchenne muscular dystrophy is also known as DMD, and it primarily affects little boys early in life. It can manifest early as delayed walking, a clumsy walker, a tiptoe walker, and also it can rapidly progress thereafter.
Now, Joanna, you live in Pennsylvania there with your husband, and you've got two sons, both of which have been diagnosed with this disease. Talk about some of the things that tipped you off, maybe that something was wrong, or did you have to be told that something was wrong?
We did notice with my older son some gross motor delays. He was, like Dr. McCormick said, he was delayed in walking, delayed in rolling over, a lot of those kind of things. And we went to our pediatrician, and a lot of times what they'll tell you is, well, kids develop it at different rates, so don't worry about it. And then finally it got to the point where, it seemed to be more pronounced, and then they led us to specialists. But I'd never heard of the disease before.
Are there treatments readily available for this type of muscular dystrophy?
There are certain things, there's certain interventions that you can take, but there's very few treatments that are available to treat the underlying cause of the disease.
So if there are very few treatments, I guess it affects about 200,000 people, or maybe a little bit more, a little bit less, to be considered a rare disease?
Yeah, exactly. If it's under 200,000, it's considered to be a rare disease. And the numbers in the United States are about 15,000 cases in the United States of Duchenne muscular dystrophy.
So what about federal drug regulators? What's going on with them to prevent folks from getting drugs that they need?
So what the challenges that are faced with rare disease population is that obviously it's a much smaller population, and that makes it more challenging to prove drug efficacy. We don't have the luxury of a large trial for, like, for example, a cholesterol drug or a hypertension drug. So that's kind of the battle that we're up against, is that there's a smaller patient population and it's harder to show efficacy, even though there are real benefits that I'm seeing in my sons.
These benefits, are they coming from a specific type of drug or treatment, or are there a variety that are being tested to see which one performs better or offers the most relief?
Well, it depends on their genetic mutation. If there's a defined genetic mutation that currently there is a drug study or available drug for treatment, then we would be able to offer this. With Joanna's boys, they have a nonsense mutation. And recall, as stated prior, that the incidence of Duchenne in the USA is only 15,000. And with the specific targeted nonsense mutation, there are assessed approximately 1,000 to 2,000 boys. So we're talking a very small subpopulation within the Duchenne population for targeted therapy.
Right. And the therapy or the drug trial that my sons have been able to be involved in that targets the non-sense mutation, it's called Translarna, and it is produced by PTC Therapeutics, who are here with us today. And again, my oldest son has been involved with the trial since he's 8 years old. My youngest son for almost 2 years, and some of the benefits that we're seeing is that they're still walking, and most boys with Duchenne between the ages of 9 and 11 lose the ability to walk. They haven't lost any upper body strength. They still enjoy playing the drums, and these are real meaningful things in their lives that sometimes don't translate into a drug study or into a clinical trial that would go, or the information would go in front of the FDA. So what I'm here today to talk about is hopefully that the FDA would open the application and talk to the patients and about the real benefits we're seeing. And I mean, this is slowing down disease progression without a doubt.
Is there any current legislation that can help, especially your family, Joanna?
Sure. Well, there's two things. FDASIA is one of the laws, and also 21st Century Cures. And what they are looking to do is, again, require the FDA to listen to the patient voice, listen to patient-reported outcomes when they are reviewing drug trial results.
Is there any place that people can go online to get some more information or to look deeper into some symptoms that they might be experiencing with their kids?
Sure. There's an organization called Parent Project Muscular Dystrophy, and their website is parentprojectmd.org. And there you can find information about the disease and what's going on as far as clinical trials and the FDA.
What type of feedback are you getting from some of the parents who are learning more about how rare the disease that their kids have, and when they find out more information and some of the obstacles as well as some of the options?
Well, I think as a physician, I can tell you that they're very much interested in drug trial for their son. And unfortunately, drug trial is not available for all. And so those boys with other mutations are not going to receive it right now. And these families are devastated. They're truly devastated because these boys will follow the natural course of the disease. For those other patients, like Joanna's boys, it's clear that they do benefit from that.
And the natural progression of the disease, you said, affects sometimes the lungs. Any muscle in the body can be affected, right?
That's right. That's right.
Any muscle, sir. Any muscle.
Okay, so the lungs, the heart. So the natural progression, if treatment is not approved, is basically a death.
It is. It's fatal. It's a fatal disorder with death in the late teens, up to approximately 30 years of age.
Joanna, from a parental standpoint, what can we do in order to get the word out there much more than it seems to be getting out there now, and maybe get some help and some more approvals down the line?
Well, again, I'm here to raise my voice, and hopefully people will be inspired to hear my story. Some of the things that people can do is go to their congressmen or their senators and tell them that they are concerned about rare disease and lack of treatments, and that the FDA needs to speed up the process to get treatments to these patients faster.
Well, I thank both of you for coming in today and talking with us about this.
Thank you very much, Neal.
Thank you, Neal, for the opportunity.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Eileen McCormick and Joanna Johnson, talking about Duchenne Muscular Dystrophy. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.